Welcome to Cascade First Aid. In today's tutorial, we're going to teach you how to use your Steri-Strips. And Dr. Garland is going to fix my wound on my face.
That's right. So this is a really common area that young boys and Mindy frequently injure is right underneath their chin. So let me back up a little bit and say a couple words about Steri-Strips. They can be used in place of stitches or sutures in some areas, and really I should say for some lacerations or cuts. So really the criteria for using a Steri-Strip should be that the wound can be closed without a lot of tension. So if you have a big gaping cut, it's not going to come together well with Steri-Strips, but really areas that have a little bit of tension should do just fine with them. So Mindy's fallen down and busted open her chin here. First thing you want to do for any wound is absolutely get it really clean. There's lots of materials here in the traverse that will fit that criteria, but absolutely getting a really nice clean wound base is critical to both wound healing and cosmetic healing, since it's on her face, and prevention of infection. So we're not going to scrub her all the way today, but I will grab this alcohol wipe because we want to make sure that we can get a clean, dry surface too. So that can go in and around the wound. It's no problem. It will sting some, so that's a nice thing to warn your patient about or yourself. And while that's drying, I'm going to open my Steris here, okay? So Steri-Strips typically have this perforated edge over here. That's really nice. It can help you lay them on flat. So her wound is pretty small. It's just on her chin. So I'm going to cut these about to the length that I need, which I think is about a little bit more than an inch. You can use the iris scissors that are included in your kit for that. I'm going to peel off this back edge. And then you're going to want to use your pickups or your forceps here. Mindy's going to put her head back, and I'm going to use my other hand to bring the wound together as best I can. I'm going to affix one side on the back side of the laceration, or the side closest to her neck. Make sure the wound is coming together like this, and then stretch the other one across the other side, and then lay it down nice and flat. We'll do one more on the back here. Make sure that wound is coming together nice and tight. And lay those down nice and flat. So wound is closed. If you have an area that has a little bit more tension than you think is best for Steris, but you don't have access to sutures right away, you can bust out your super glue and just glue down the edges. 1, 2, 3, 4. Try not to get that directly in the wound because it will burn, and for sure don't stick it on your fingers or in your eyes because you'll be stuck to whatever you touch. All right, thanks.